Hosting a television show is so tough. Work is so tough. You may ask, what am I doing? Well, as you know on the show, we love to put things to the test when they come out. So I am actually laying on an LED light bed, and I'm relaxing on it. I must say it's quite comfortable. Now, realistically, you're supposed to do this for 40 minutes, which obviously I don't have time to do. So before and during our show, two guests actually put this LED bed to the test with the full recommended 40 minutes. They are now here, Debbie and Tara. And before we ask them how they felt about it, there's a lot of really great theories out there about LED light therapy.
Exactly, and so what's really interesting about this is even though it looks like it is not a tanning bed, it is not ultraviolet or laser, it's not hot. These LEDs are light-emitting diodes, and they're giving out visible light that's meant to improve your circulation. And in this case, this bed is actually touted for arthritis, for any sort of joint pains, and it's meant because of how it works, the light is absorbed in the skin. And the idea is then it's absorbed by different target structures and works via a mechanism called nitric oxide, which increases circulation.
By the way, really quick.
The active ingredient in Viagra is stimulating nitric oxide. So did you feel anything stirring or?
This is a really cool concept because in dermatology, we often use LEDs because we're talking about wrinkles, anti-aging, acne, and we were talking about how there's even an attachment here for
your face.
But in this case, the principle is that when it goes in fact, we have a lovely graphic right here of someone lying on the LED bed, and this is a knee, and you can see that LED, that light being absorbed in the muscle, it's increasing the circulation. So you see how those blood vessels are changing. That's the proposed mechanism of this.
Debbie, Tara, obviously you just put this to the test. Thoughts?
I actually have been suffering from a recent back injury where I've been having a lot of muscle spasms in my back. And since the treatment, fingers crossed, I haven't had a single muscle spasm in my back. And I actually fell asleep the second half.
Which is never a bad thing. Debbie, what was your experience?
I think it was really good. I'm used to working out every day. And lately I haven't worked out as much because I've woken up with too much pain and didn't want to deal with it. I tried the LightStim LED bed, and it was great. It was something that not going to erase all of my pain, but it made things better, and I'm feeling like I'm excited to leave here and go for a run.
So
well, and the one thing,
even one session, you feel a difference.
Now, the one thing I will say, opposite of what we often talk about on the show, is you're not all going home with one because they cost $65,000. But more and more med spas are offering this as an adjunct to a lot of the other things that you may find at a med spa.
And $100 to $200 a session if you were to do it like that. So
this isn't something that...
massage. It's going to...
Yeah.
In lieu of a massage,
it does.
Potentially,
there's a lot
you could make a case for your brain and Alzheimer's and lung health.
I can already see you getting one of these, having your cocktail, your blue pill, just laying on this bad boy.
You know what? I love the cocktail hour on your LED, and then
Debbie, Tara, thank you both for trying this out.